And very simple. A lot of people, they think cleaning is the same like bleaching or whitening. It's a different process. You cannot have bleaching without cleaning. You have to clean your teeth, make sure everything is perfect, and then you can go to the bleaching. The bleaching, as I said, is or the whitening. There's two techniques. One of them is in office, which we use the LED light and mistakenly taking a lot of people being misled by thinking it's a laser. Actually, it's not a laser, it's LED light. It's a 1 hour procedure, very simple.
Non-painful, we can say, or partially there's some kind of pain.
I just had it 2 weeks ago. It's a very simple procedure. It's very easy, and I didn't feel any uncomfortable.
Good.
The problem sometimes is with the operator, with the doctor, or with the staff that doing the bleaching for the patient. Sometimes, unfortunately, the doctor, they're not involved with the process. The staff or the nurse who
she's in charge of doing this bleaching.
Sometimes the material leak to the gum that could cause
irritant. It's irritant. Yes.
Also, we have to understand that we have to choose the patient that fit and suitable for the bleaching process. They have to have no fillings in the front. If they have crowns or caps in the front, they're not going to be bleached because the bleaching.
Can we explain this for our viewers? What could bleaching do if they have an implant with a cap or a crown or a prosthesis and they come and bleach afterwards? What's going to be the difference?
There might be a minor difference if the color of the implant was dark or the crown of natural teeth. Usually the bleaching works only in the natural teeth. It doesn't work in a crown or implant or a filling. So they have to understand that there might be a little bit differences. That's why when we choose the color for a permanent restoration, we have to check with the doctor and with the patient that what is the plan of the patient in the future. If they are planning to have a bleaching, if they are planning to have their teeth whitened, you know, they should choose maybe a lighter color when they have the final processing.
Yes. We can see in this picture that she's having a beautiful Hollywood smile and she's eating an apple. So once they do the bleaching, can they eat certain kind of foods, or do you advise them not to eat certain kind of foods with certain colors?
Well, after the bleaching, especially the laser bleaching in the office or the LED bleaching, they're not supposed to eat or drink coffee for maybe 1 or 2 days.
Coffee? Also this is one option. They're not supposed to take.
Yes, because of the color inside. Yeah. Also tea. The soft drinks.
Let's say the dark colors, soft drinks.
Dark colors, even the food sometimes with the certain discoloration. After 1 day, they can have and enjoy their life back to normal.
What about the berries that they give colors? The blueberries, the raspberries, the
they're
blackberries?
They're not supposed to be
they're not supposed to eat
in the first day.
Okay.
Yeah, because what we do is we open the tubes inside the tooth where the staining is being deposited before.
Okay.
That tubes is open after we do the bleaching, and the color could be deposited again and again if we do it. That's why we have to wait maybe 1 or 2 days and go back to our normal lifestyle.
Yes, we would like to see this reportage about bleaching, and we will be back with Dr. Isam.
Good evening. This is Dr. Majid Radwan, working at Smoking Cessation Clinic at Abdurrahman Abdul Mughni Clinic at Al Fayha. Now we are going to speak about smoking. Smoking is the most killer thing in this century, as WHO stated that smoking kills almost 6 million persons every year because of many diseases. Smokers start smoking by age 12, 13 or whatever, and still smoking and stay smoking for a long time. By this time, the smoker will get many diseases. The doctors and scientists, they gather the diseases because of smoking are almost 40 diseases. I can say that smoking cigarette, only one cigarette contains more than 4,700 chemicals in only one cigarette. The most lethal and the most dangerous things or chemicals in each cigarette is 3 ones. 3 ones. The first one is nicotine, the second is tar, and the third one is carbon monoxide. All these things, 3 elements, are stated in each pack. I give an example. This one is the tar. If I give a look on any cigarette pack, you can see this tar. You can read in the cigarette pack that every cigarette contains 8 milligram of tar. Now, you can imagine with each cigarette you smoke that you take this tar in 8 milligram or whatever, 8, 10, 6 milligram of tar, you inhale this tar to your lungs. Now you can see your lung as a smoker. This lung will turn to be this color, will be dark. So you can imagine what you take to your lung. The lung will turn to be this black color because of tar. The smoker's lungs, this is a smoker's lungs. The tar is the causative agent and is the cause for cancer of the lung with other 6 elements in the cigarette. Also, the cigarette contains nicotine. Nicotine known as an addictive agent. It causes addiction, and not only the addiction, but also the nicotine causing narrowing of blood vessels, narrowing of arteries, especially the arteries of the heart, what's called the coronaries. So the first thing will be affected in the smoker will be his heart. See, we see young people has a problem, cardiac problem with their hearts because of smoking. They are smoking for 10 or 15 years. The arteries will be narrowed because of nicotine. The third element will be carbon monoxide. Everyone knows what is carbon monoxide. It is a poison. A poison. If we stay in closed place and there is a burn, the carbon monoxide will evaporate and will cause people, if the carbon monoxide will still come up, the people will be poisoned because of carbon monoxide. So you can imagine as a smoker that what you take to your health will affect your health. People who smoke hubble bubble or what's called nargila, they will get more, maybe 100 times more of carbon monoxide than who smoking cigarettes. And you know carbon monoxide will be the causative agent for heart or cardiac diseases, the main cause for this carbon monoxide, and can cause poison. So if you use hubble bubble, you burn charcoal, not just a paper of cigarette. Finally, my advice for all smokers to stop now and not to postpone. I will stop tomorrow or next week. No, stop now for your health and the health of your lovers, your family, and everyone be around you. Thank you, and see you in our clinic at Taiha. We are working on Sunday, Tuesday from 4 to 8 p.m. every Sunday and Tuesday. Goodbye.
Dr. Isam, we just spoke about the office bleaching, and we know how it's done. It's either done by a prosthodontist or a special dentist, or it could be done by any of the nursing staff. We want to know about the home bleaching, how safe it is, and is the commercial that they put sometimes in the advertisement. Is it useful or not?
The home bleaching is, I found out it's very effective. The result is amazing, but the problem is the compliance of the patient. It's very difficult sometimes for certain patients to have something in their mouth for 2 to 3 hours. The material is could have some burning sensation if
It's irritant.
It's little bit, not
Irritant.
too much.
Not too much, yes.
Yeah, but we have to understand also that even the process of doing the white or the bleaching at home, it should be done by under the supervision of the doctor too.
Definitely.
A lot of people, unfortunately, they do it, or they tend to try to have the bleaching without the supervision of a doctor. Sometimes the tray that the patient wears at night, it doesn't fit their mouth. The material could leak and go back and go down over the gum. That's where we have the problems, and we have the discomfort, and we have the bad experience that sometimes patient going through when they have the home bleaching.
Yes.
This tend to make them not to continue the bleaching. As I told you, get them to a bad experience. But the result, if everything was done correctly, the result of the home bleaching could be perfect. It could last longer time than the laser or the office bleaching.
How often does the home bleaching require to be done? How often per week?
It depends on the manufacturer or the company that's selling the material. In general, it's about 10 to 2 weeks, 10 days to 2 weeks.
Every 10 days they should put the cap,
No,
you mean?
They,
or the whole process?
They do it continuously for 10 days.
Daily for 10 days.
For 10
Okay.
days, yeah.
What about the dental strips that they sell now in the pharmacies and over the counter and the supermarkets? We
Yeah.
see those dental strips.
This is another thing. A lot of patients, they try to avoid going to the dentist.
Yes.
Business-wise, companies, billion firms and companies and pharmaceutical companies, they came up with the different ideas for this kind of patient who are trying to avoid to go to the dentist. So what they came up with is they came up with the strips that you're talking about. They came up with the material that you can buy in the pharmacy over the counter without the prescription of a doctor.
Yes.
All of them, they have if the home bleaching takes 10 days, the other material will take maybe 50 days to have the
50 days,
result.
2 months almost, yes.
Because the material is not concentrated, the material is not confined to the tooth, because you just put something general. It could
Yes.
be, it could fit your mouth, it fit my mouth, it fit
It fits
anybody's mouth.
everybody's. It's one size fits for all.
Exactly,
You
so
just put the strip and just bend it over.
It's not like the
Yes.
home kit that where
Yes.
it's been designed and tailored just for you.
Mhm.
That's why some patients, they have the feeling that it could be a good result because they're trying to avoid to go to the dentist.
Okay, so we spoke about the dental strips and the bleaching and the cosmesis part. And some people, they don't want to keep on bleaching every now and then, especially if they're smokers or especially if they drink a lot of tea and coffee. They want this Hollywood smile, the veneers and lumineers. First, we would like to explain to our viewers, what's the difference between veneers and lumineers?
Lumineers and veneers are basically the same. Lumineers is a trade name or a trademark for a company that makes certain kind of veneers. The company is based in the US. There's advantages and disadvantages for the lumineers, but I'm not in the place to talk about it now. But in general, I'm talking about the veneers. The veneers are small, thin lens that been placed over the tooth. We cover the outer part of the tooth. We don't cover inside, we don't cover the side, we just cover the outer part of the tooth. It's a very delicate procedure, very difficult procedure for the dentist to do it. He has to know, or she has to know, what they are doing exactly. Cementation of this kind of material is very scientific, and it should go through a lot of process and steps. Unfortunately, a lot of dentists, they are not familiar with the whole details that comes with the veneers.
Yes.
Sometimes you can find veneers that they are all connected together. The patient cannot floss there is an opening, there is color changes, there is a smell sometimes coming from the veneers because of the thing has not going in the right way.
Yes, as we see from this picture, Dr. Isam, what did this lady have, as from your experience?
I think she has some discoloration in the teeth. She has differences in the
size of the height, and she increased the height.
I think she has a bruxism, that where teeth has been grinded together.
Yes.
Which led to losing of the vertical dimension and losing in the length of the tooth.
Yes.
It's very common for middle-aged women to have this kind of problem. It's very common for businessmen sometimes to have this kind of problem. It's very common also.
Why did you mention mid-age women and men, and those that work in the offices? What do they grind their teeth?
Sometimes
or something?
they tend to grind their teeth.
Grinding.
Yes.
Grinding is just like it's friction between the upper and lower teeth.
Exactly.
Just to explain to our viewers.
If we diagnose the problem, if we detect the damage earlier, we can stop this process from happening.
And could they have a prosthesis of putting veneers on their teeth?
They could, but there's a tendency that they might lose or break the veneers because of their habit.
Yes. Dr. Isam, we will break now, and we will be back with cosmetic dentistry.
Hello, this is Dr. Ibraهيم from the dental department in Abdullah Al Abdel Hadi Health Center in Al Yarmouk area. Today, I'm going to show you how to clean the teeth from the tartar and calculus, and we call that scaling. Now, we're going to start with Mr. Jabir, his regular visit after 6 months from the last scaling. Now we're going to start, as you see. Please, suction system. Are you comfortable? Abdullah? You okay? Jabir? Okay, good. Scaling is a prophylactic procedure. Can prevent the gum disease. Gum bleeding is the first sign of gum disease. As you see, there is some bleeding